A government watchdog group is accusing officials in the Kenya Medical Supplies Agency of embezzling some $2 billion in aid meant to help Kenya combat COVID-19.
These are some of the PPE kits she supplied.
Dr. Gordwins Agutu, CEO of the Network Action Against Corruption, an organization sanctioned by the government to promote fiscal accountability, raised the accusations against KEMSA, a government agency mandated to supply medical equipment and medicine to the Ministry of Health. The network says officials in KEMSA ran two schemes. In one, the organization paid for personal protective equipment, or PPEs, that was actually donated by the Jack Ma Foundation. The money then went to phony companies controlled by the KEMSA officials. In the other scheme, KEMSA officials contracted with fictitious shell companies to supply protective equipment. No equipment was supplied, but the companies got paid anyway. Speaking to VOA, Dr. Agutu said the officials also planned to resell PPEs on the black market.
The PPE kits consist of a number of items. But you realize even these particular people, what they used to do, the PPE kits which they stole from Jack Ma's donation, they would break it down. So they have the coveralls separately, they have the boots separately, they have the supplied separately. So you can imagine how much were they intending to make out of that?
Kenya's President Kenyatta has ordered a forensic audit into the use of both state and donor funds meant to be used to combat COVID-19.
No persons found to be prima facie culpable as a result of those ongoing investigations should be brought to book.
International bodies like the International Monetary Fund and the World Bank have channeled about $2 billion in funds to help the country fight COVID. Both organizations have called for transparency in how the money is being used. A civil society group says mismanagement of the money and protective gear is affecting Kenya's COVID preparedness and response.
As a country, we'll have to deal with paying the public debt. We'll have to deal with an impact on service delivery. We've seen that even as we speak now, the level of preparedness for COVID is still not there yet. The isolation units that were meant to be put up, are not ready. We've seen doctors complaining about lack of PPEs. So it would seem that we got these resources, but we have not used them for the right reason, and yet we will continuously pay for them.
According to the Kenyan Medical Practitioners and Dentists Union, the shortage of protective supplies coupled with the low quality of those made available is having far-reaching effects.
The doctors and the workers working in the outpatient department should be given N95 each and every day they see patients. Due to lack of enough and quality PPEs has led to more than almost 1,000 healthcare workers being infected with the coronavirus.
The country's Senate and investigative agencies have been tasked with unraveling the allegations of funds misappropriation. Meanwhile, Kenya's health ministry has recorded more than 36,000 confirmed cases of COVID-19. Lenny Ruvaga for VOA News, Nairobi, Kenya.